discussion of antineoplastic agents found in Chapter 14 will only skim the surface of the specialty of oncology nursing. The purpose of this discussion will be to give you the basics that nurses need to deliver safe care upon graduation from school, and will be supported by the discussion you will have in your med-surg courses. While antineoplastic drugs alter abnormal cells of cancer, they also affect normal cells, particularly rapidly growing cells such as those of the blood. This results in a variety of adverse effects, and more recent advanced chemotherapy includes drugs that act on the immune system. This chapter starts with a discussion of what cancer is. Terms related to cancer that you need to know include neoplasm, or cancerous growth, and nadir, the lowest point in the concentration of blood cells. You will find more on that on page 224 in box 14.5 that talks about dealing with bone marrow suppression. Most chemotherapy drugs do cause bone marrow suppression, which lowers white blood cell, red blood cell, and platelet counts. The nadir is when the bone marrow suppression is at the highest, or your counts are at the lowest. This happens usually between 7 and 14 days after chemotherapy is administered, and resolved within 3 to 4 weeks, when the cells in the bone marrow mature and are released into the peripheral bloodstream. Cancer treatment is usually held for an ANC, or an absolute neutrophil count, of less than 1,000 to 1,500. Metastasis occurs when cells leave that cancer and spread by blood, lymph, or direct extension to another area of the body. This movement results in the same kind of cancer being found in a different location of the body. Other side effects of chemotherapy that we will talk about in a few minutes include alopecia, or hair loss, and stomatitis, or GI tract and mouth sores. All antineoplastics have adverse effects. They disrupt the cell cycle in different phases to stop replication and cell metabolism. Some work through the entire cycle, and others work on a specific part of the cell. They can be used in combination therapy, and when used in this manner, it is important to choose drugs that do not have the same adverse effects. These drugs are often given in cycles, such as between 1 month or 1, 2, 3 weeks in a row, and then a break for a week, or another cycle, particularly to the way that those drugs work. Slides 4 and 5 go together. They include a class of drugs, the drug in that class, an indication, and on slide 5, the adverse effects. It is important for you to learn the drug, the indication, and the adverse effects, as these will be common drugs that you will see in practice and that you will be tested on. Methotrexate is used for rheumatoid arthritis, psoriatic arthritis, psoriasis, leukemia, and has side effects of hepatotoxicity and bone marrow suppression. 2 antibiotics that we often use for chemotherapy include bleomycin and doxorubicin. They treat lymphomas, testicular and squamous cell cancers. Bleomycin commonly causes GI toxicity and skin reactions, while doxorubicin is cardiac toxic and can cause alopecia, can turn the urine red, and can cause bone marrow suppression. In teaching the client about doxorubicin, it is important to include that red urine color so that they will not be surprised when that appears. However, another thing that has to happen with doxorubicin is that prior to administering the drug, cardiac status needs to be evaluated so that a baseline is established and early recognition of cardiac toxicity can occur. Cyclophosphamide and cisplatin are used to treat testicular, ovarian, and bladder cancers. Cyclophosphamide commonly causes hemorrhagic cystitis, and cisplatin commonly is neuro and nephrotoxic. Vincristine is another chemotherapy drug that is used to treat leukemias and lymphomas. It has many adverse effects, including central nervous system effects, GI toxicity, alopecia, and inappropriate secretion of ADH, So patients need to have their urine output monitored while on vincristine. A hormone manipulator is tamoxifen. It is commonly used to treat breast cancer. It produces menopausal symptoms, bone marrow depression, central nervous system depression, is GI toxic, and can cause visual changes. And here are those listed on slide 5. Adverse effects, as mentioned earlier, are drug specific and related to the effects of the drug on the fastest growing cells. There are many systemic effects of drugs, and since chemotherapy is administered systemically, these medications can cause many different adverse effects. Since cell death is the result of all chemotherapy agents, patients undergoing chemotherapy treatment are at risk for elevated uric acid levels. Allopurinol is commonly administered to patients to manage these uric acid levels. And bone marrow suppression is dose limiting. Treatments may have to be postponed for decreased WBC, RBC, or platelet counts. Some meds are toxic to the heart, liver, and lungs, so tests may be needed before these drugs are started, as mentioned previously. Patients who have neurotoxic drugs may lose the feeling in their fingers and may be unable to button their shirts or perform other activities of daily living. Some chemotherapy drugs are toxic to reproduction. Sperm banking may be necessary if the individual has a desire to father a baby after the chemotherapy treatment has been completed. Use of birth control while on chemotherapy is essential for male and females, and chemotherapy must be avoided when pregnant and lactating due to harm to the fetus and the baby. This often creates some very difficult decisions for the individual who is anticipating chemotherapy treatment for cancer. Preventing nausea and vomiting. Nausea and vomiting is a common side effect of chemotherapy, and antiemetics must be used for all patients who are undergoing chemotherapy. Box 14.6 we'll discuss on page 224. We'll discuss antiemetics in cancer chemotherapy. Several antiemetics are often combined to provide effective treatment of nausea and vomiting. This slide lists some of these drugs that we have already talked about. It is important to teach the patient to take these around the clock to prevent or minimize nausea, and it is also important for them to take them prior to their chemotherapy administration in order to also help prevent nausea. Since bone marrow suppression is often dose limiting and neutropenia can put the patient at risk for deadly infections, these agents are given for decreased red blood cell and white blood cell. We have talked about them earlier this semester. The adverse effects of these drugs are bone pain. There are no agents for platelets. Treating bone marrow suppression is found in box 14.5 on page 224. So please review that. Neutropenia is a decrease in the number of circulating neutrophils. And as I mentioned early, an ANC of less than 1,000 to 1,500 can often postpone chemotherapy. The absolute neutrophil count is very important, so monitoring this is part of the nurse's responsibility. Managing other adverse effects. For alopecia, these are found in your chapter under the nursing considerations, so you need to read those as you are perusing this chapter. Alopecia, cover the head with a wig, hat, or scarf in extreme temperatures, as the body temperature is often controlled by that of the head. We have a lot of volume there. And fatigue, the patient needs to plan rest periods and safety measures if they're having trouble with balance. So being sure that they understand that fatigue is common and that planning rest is important for them. Nutrition to manage nausea and vomiting. In addition to the drugs that we use, individuals may want to have frequent small meals Be sure to hydrate themselves even when they're experiencing nausea. It is extremely important to have adequate hydration in order to prevent and diminish the effects of the chemotherapy on the kidney and to prevent kidney damage. And mouth care is extremely important for these patients in order to keep the mouth clean, to use medicines that can relieve the pain of stomatitis. So be sure that you have talked to your patients and monitor that as well. This is the typical use of our picture of a chemotherapy room, particularly an outpatient chemotherapy room where individuals go to get their chemotherapy. They develop relationships with other patients and their families who also come to get chemotherapy on the same days. And so this was just a picture to show you what a room like that would look like. Safe administration is very important when you are caring for an individual who is taking chemotherapy. Nurses attend extra classes in order to become chemotherapy certified. These drugs are hazardous and should be treated with caution and according to the hospital protocol. Your nurses must keep themselves safe and should avoid skin, eye, or mucous membrane contact with drug. Strict hand washing protocols should be followed both before and after preparation and administration. Special chemotherapy gowns and gloves are used and disposed of in chemotherapy hazardous waste containers. If splashing is a risk, then you should wear shields, and face shields should be worn. Special tubing prevents backflow is used to administer IV chemotherapy. Here are some of the examples of safe administration. Let's talk about extravasation. The best treatment for extravasation of a chemotherapeutic drug is prevention. The treatment is specific for each antidote, and on page 235, just read the narrative only that talks about the focus of safe prevention and treatment of extravasation. It is not important to learn the drugs and the antidotes, but it is important to understand that prevention is the best way to treat this severe complication of chemotherapeutic administration. There are some things to review for your understanding that I have listed on this slide, including the chapter summary and the critical thinking scenario of antineoplastic therapy and breast cancer. The others I have already mentioned in the presentation. And 2 questions to check your understanding. Which nursing action is not appropriate for the client receiving doxorubicin? So look that up. And the nurse administered the prescribed dose of ondansetron to a client who's receiving chemotherapy 30 minutes ago. What is that nurse's best action at this time? So think through those 2 scenarios to check your understanding. Thank you.